you all for this national broadcast of the NEET PG mock test. Some of our classmates are taking the JIPMER exam, and I'm very sure they must be thinking about all of us while taking the exam, because the actual exam also will have similar questions, similar kind of broken dichotomous thoughts in the mind. Is it A, is it B, etc., etc. So with that preamble, let's make the great beginning. Monica, Karthik, Lakh, Rocket Trader, and many more. What is true about breath holding spells? Question number 6. I can see Mithul Hirani proposing C, but cyanosis is the hallmark of breath holding spell. Bradycardia is seen. It is involuntary. No child will plan to get breath holding spell. It is not inspiration. It is the expiration during which the breath holding spells come is what you have to basically remember. You can text your classmates, tell them that the discussion has started, and they can join the evening. Very happy to see 70 plus online students. Thalassemia carrier. What will they be having? How do you identify? If you do electrophoresis, hemoglobin A2 more than 3.5% is an important indication of the carrier of the thalassemia, is what you need to remember. Since there are almost 120 questions I need to discuss within the next 2 hours, some questions I will go very fast without looking or waiting for your answer. Some questions I put for sale and fight on it, answer it, and then check whether you are correctly answered or not. A 3-year-old male, poor stream of urine and strains at micturition. After voiding the bladder, still the bladder is palpable. What is the important investigation you want to do? Always remember one thing, doctor. A female child is having, even on that AC also, OB on kar. If a female child is having UTI, there is less to worry. But a male child with a long urethra is still having recurrent UTI, means always you should evaluate. Is a golden principle. Very good. Lakh says, Sunita, Monica, you're all differing between C versus D. First, do simple urine examination. Look for the pustules in the urine. Be sure that it is a UTI responsible, and once you are sure that it is UTI, then you need to do the remaining investigations. Renal ultrasound to detect hydronephrosis, and micturating cystourethrogram to diagnose and grade the vesico-ureteric reflux is what you have to remember. And all the pregnancies complicated by oligohydramnios, you should suspect the possibility of the renal agenesis or a post-urethral valve. And all the children born with the maternal obstetrical history of oligohydramnios should be evaluated for any genitourinary abnormalities, is what you need to remember. This question is for sale. Please punch your answers. Please punch your answers. A 2-year-old child has a weight less than 3 standard deviations and mid-arm circumference less than 11. So what kind of grade of malnutrition is this? Is a very important question. Shika Munka is saying, sir, notes kahan tak hai? On Wednesday we will launch the new version of the app where you have the notes, you can bookmark, you can be able to voice record, you can keep the slides as reminders to set up notifications. All the features will come Take it as my promise. Tomorrow, day after tomorrow, we will do the final round of testing. Okay. Once all these notes is available, you can decide to bookmark and set up reminder for whichever the slide that you liked. As such, the slide totally will be available on the UMedico app. It is severe acute malnutrition is what you need to remember. So weight for height less than -3 standard deviation and the mid-arm circumference less than 11.5 centimeters is considered to be diagnostic of acute severe malnutrition is what you need to remember. For a 3-year-old child, the height for the age is 82%, weight per height is 65%. What do you like to label this child as? Question number 10 is for sale. Please shoot your answer, doctor. Question number 10. Is the voice clear? If that AC sound is not catching, right? Yeah. Question number 10. Can you please punch your answer? That's good. Karthik and everybody is saying stunted. Only stunted? Only stunted you like to call it as? Om Prakash Jindabad. Wasted and also stunted. You should know. Low weight for height is wasting. Low height for age is called as stunting, is what you have to basically remember. For a early diagnosis of HIV, what do you use in the national program? Question number 11 for sale. Please punch your answers. Question number 11. Which is the one in the national program approved for the HIV evaluation is a very, very important question. Yes. So, I can see Rocket Trader saying CD4 count. Come on. Karthik Kancharla is absolutely right. He says it is P24. No, not right. Not Karthik is not right. Akash Rai and Dr. Nagle absolutely right. It is DNA PCR test is what you have to basically remember. A normal 3-year-old baby will be able to do all these tasks except one task which is for the 4-year-old baby. Ab batao, what is that particular task? Question number 12. Ooh, ah, ouch. What is your answer? So after the exam is over, we come out and we know that it is a wrong answer and common expression is, oh, ooh, ah, ouch. So, but you should be very sure that no, ooh, ah, ouch. Very good. Rituraj, everybody is rocking, absolutely copying a square is 4 years. So you should be very sure, doctor, without a second part, one question, even today Jipmer में भी एक developmental milestone के बिना question paper नहीं होगा, is what you need to remember.